tell us exactly what you're changing anatomically.
So right here, we're going to address the palate. The nose, the palate, and the back of the tongue or base of tongue can cause obstruction. But here, you see the edge, normal edge of the palate is right here and right here. And extending down from that are what we call palatal curtains. This is the uvula, which is the dangly thing people see in the back of their throat. You can see it's longer and it's thicker. So we're going to go ahead and grab that uvula. We're going to pull it to the side, and we're going to make an incision in this palatal curtain.
What kind of anesthesia are you working with?
We're using intravenous anesthesia, so I have my anesthesiologist, and he's par excellence. And he is giving some intravenous sedation, the same type of sedation that you would see when you were doing a colonoscopy or that type of thing. So instant on, instant off intravenous anesthesia. So you can see I'm now going to make an incision in this uvula.
So Dr. Mandel, you're removing that excess hanging part of the uvula, correct?
I am. And you can see I'm kind of teasing out some of this muscle here, which is actually kind of an important part of this as well.
Right. Bloodless. Beautiful.
So that's that. Okay, so that's the hardest part of the procedure right there. Now what we're going to do is we're going to use a contact diode laser. And what I do with the contact diode laser is I make a very controlled abrasion in the center of the palate. I developed this procedure myself, and I've been doing it for about 7 years now. We have about an 85% success rate in terms of getting people off of CPAP, so they don't need to use it anymore. Works very well for snoring as well. You can see here I'm going ahead and I'm passing this contact diode laser beneath the lining of the palate. And what that does is it creates what we call linear scars or straight line scars. And straight line scars, as they heal, they contract. So you can see I'm going all the way down here to the tip here, next to that resected uvula. And I'm just creating these straight line scars.
So what those are doing are adding support and structure to that floppy, soft palate. It's sort of, you're creating like shirt stays in your collar to keep that collar nice and stiff. The scar tissue acts as sort of a shirt stay and keeps that palate firm, correct?
This only takes about 3 minutes.
We're done.
So
That's the end of the procedure.
In 3 minutes, the freight train is just gone.
It's gone.
You mean to tell me? I mean, because honestly,
you're going to have your bedmate back.
Even family members. I mean, God bless them. You go in for Christmas or something, and they're just snoring and snoring. You mean to tell me in 3 minutes I can remove all of that stress from my life?
It is done.
That's amazing.
That is amazing.
Okay, I'm going to come back in front of the camera to talk to you guys again.
So, how much discomfort is Andy going to have after this?
So I always tell people, you are going to get a pretty significant sore throat afterwards. It's not as bad as having your tonsils out by any stretch of the imagination, but it's a significant enough sore throat that you'll feel it. Soft diet for a couple of weeks, but more than well worth it.
This is going to save a lot of marriages. I can't believe how excited you are about this.
I'm very excited.
I guess you've got snorers around you there.
Yeah,
Doc,
I have some people that I want to introduce you to. Like, seriously.
Happy to meet them.
That makes a good Christmas present. Well, anyways, Dr. Mandel, thank you so much. Amazing stuff. Continued success. For more information on the minimally invasive palatal stiffening procedure, you can go to our website at thedoctorstv.com.